Good afternoon, Gesner. I'm a nurse practitioner. I'm going to be taking care of you today. How are you feeling?
I'm feeling great.
All right, that's great. That's great to hear. Last time I saw you, you were having a little bit of issues and whatnot with shortness of breath, and you had mentioned to me just now that all that had resolved, and that's great, and that you're not smoking anymore. So that's all good to hear. I'm a nurse practitioner student, and I'm Quincy Woods, and I'm going to be assessing Gesner's ears, eyes, nose, throat, and head. So first thing that I'm going to do when I'm greeting my patient is I'm going to look for symmetry of his eyes, of his face in general, his ear positions, his nose, make sure there's no displacement with his nose, assess for any uh, broken noses in the past, and make sure that he's able to breathe well through his sinus cavities. All right. And so one of the first things that I'll do after asking him questions is I'm going to look at his hair. I want to see that it's well kept, make sure that he's not in any apparent distress. And I'm going to view around his head and the back of his head. And then I will feel, so I'm going to feel your head here, Gesner. And I'm going to feel for his occipital lymph nodes in the back, make sure there's no swelling. And I'll ask him, have you noticed any swelling or headaches? I'm going to pull his hair and make sure he's not having any loss of hair, no receded hairline. And then as I come around, I'm going to continue to feel for symmetry. And I want to check here behind his ears. Have you noticed any pain or swelling in your throat?
No.
I'm going right now, I'm checking his lymph nodes here. And I'll follow down his neck. Check his thoracic lymph nodes, as well as his axillary. Can you lift your arms a little bit for me? Perfect. And you can let them rest. All right. And I feel no swelling. He has no complaint of swelling or tenderness in his neck, under his arms. Now what I want to do is check his nose and feel for any tenderness and press on his sinuses as well. So I'll check his frontal sinuses here. Have you noticed any pressure in your forehead?
No.
No. Has your nose been tender at all? Any irritation?
No.
And I'll check his lower sinuses as well. Everything feels good. Nothing is swollen. He reports no tenderness. So now, Gesner, have you noticed any problems with swallowing or any sore throats?
No.
No? Okay, and at this point, I would give him some water, and I would ask him to swallow, and I would check his thyroid gland as well. So we'll pretend that I've given him some water, and I'm just going to feel for his thyroid gland here. It's going to feel like I'm choking you a little bit, okay? So don't be too uncomfortable. Can you swallow for me? Okay, perfect. His trachea is midline. His thyroid gland is midline as well. Moves with swallowing, no swelling. Everything appears to be in great order. Gesner, what I'm going to do now is I'm actually going to look in your ears. And so as I'm looking at Gesner's ears, I've already checked for symmetry, any redness, any irritation around the outer ear. And you just relax. I'm going to pull down on your ear, and I'm going to take a look in. You let me know if anything is uncomfortable or if you feel any pain, okay?
Okay.
Have you had any ear aches lately?
No.
All right. All right. And when I'm looking through, there's no earwax that's obstructing the view. Ear canal is in good health. Nothing is irritated or swollen or red. I can see the tympanic membrane. The tympanic membrane is pearly gray and shiny. No redness or swelling. And so I'll assess the opposite ear as well. How about for this ear, Gesner? Have you noticed any swelling, redness?
No.
There is some earwax in this ear, still not obstructing the view. The ear canal is not red, swollen, or irritated. Tympanic membrane is gray, pearly gray, and shiny. No irritation noted. Now what I'll do is I'll change my piece here, and I'm going to check in his nose. Have you had any nasal discharge, any discoloration?
No.
Okay. No sinuses or allergies?
No.
All right. So I'm going to take a look into his nose. No redness or swelling. Airway is clear. And it is the same for the other. And I will now change my tool. So Gesner, I believe you told me that you haven't had any sore throats or swelling?
No.
Have you ever had your tonsils removed?
No.
Okay. How about your molars? Do you have all of your teeth?
Yes.
Okay. Have you had any dental work, any crowns?
I was supposed to get a crown. I had the feeling, and I was supposed to come back for a crown. I never went, and then I also was supposed to go back for a bridge. They didn't do it yet.
Okay. Have you had any painness in your jaw or in your teeth?
No.
Okay, so before I look in Gesner's mouth, I want to check for his jaw structure and make sure there's no clicking. Make sure there's full range of motion. All right, so I'm just going to feel here, and I want you to open your mouth for me and close. Is any of that uncomfortable for you?
No.
Okay, full range of motion, and there's no tenderness in his jaw. So now what I'll do is I will check his tonsils as well as his uvula. I'm going to check his soft and hard palate to make sure there's rise, and I'm going to check his gag reflex. So I'm going to get you to open your mouth for me. Just say ah. Okay, can you stick your tongue out? All right, say ah one more time. Okay. His tonsils are not swollen. There's no redness in the back of his throat or irritation. His uvula is midline. It rises with gag reflex. I don't have the tools to check his gag reflex, so that will just be stated that I've done that as well. And so can you stick your tongue out for me and stick it to the right side and to the left? Okay, and then can you stick your tongue out and then in? All right, tongue returns to midline on its own as I move the tongue to the right and to the left if I had my tools. He has all of his teeth. There are no blisters or redness on his cheeks or in his oral cavity. Everything appears to be normal for Gesner's mouth and for his throat, as well as his teeth. Now I'm going to check your eyesight. I previously checked Gesner's eyesight with the Snelling's chart, and now I'm going to check Gesner's fundus, check his macula, and check his retina. All right, so I'm looking at Gesner's eye right now. First thing I'm going to assess for, I'm going to shine a light in your eye. It's going to be a little uncomfortable. Okay. Pupils are equal, round, and reactive to light, symmetric. The whites of his eyes have no distortion, no irritation. Have you had any vision changes recently?
No.
No? All right, and on his Snelling's chart, his vision was 20/20. I'm going to take a look in your eye. It's just going to be a little uncomfortable. It can be bright. It'll just take a minute though, and then I'll be done, and I'll move on to your other eye. Okay. I'm going to assess Gesner's right eye using my right hand. You're going to have to lift your eyelid just a touch. And if you will, just focus on a distant point over at this wall for me, okay? Okay. No signs of retinopathy. Retina are sharp. Macula is visible. And again, focus on the wall for me over there, just a distant part. Okay. And again, no signs of retinopathy. Macula is sharply visible. No irritation or any other vision problems are noted. So now we have, can you follow my finger for me? I'm going to check Gesner's ocular nerve and make sure that he's able to follow my finger just with his eyes. So just with your eyes, follow my finger for me. I'm going to check the 6 cardinal signs here. returning to midline at every direction. Gesner is able to follow with his eyes, no problems. Noted. All right, Gesner. Well, everything looks great. You appear to be in good health. Keep up the good work and the good exercise. And I'll see you here in about a month or two. Okay.
Thank you.
Thank you.